Morning and welcome to the 2021 Georgia Bioinnovation Summit. We're very excited for our 20th year of hosting this outstanding conference that represents our life sciences sector here in Georgia. This year, we are hosting the conference differently. Again, we're virtual once again, but we're going to spread it out over a few days. Yesterday, we had an exciting day highlighting all of our scientific research posters from students across our state. And we also kicked off with a careers in life sciences panel, which I encourage you to go back and view at your pleasure. This morning, our day two is going to kick off with an outstanding conversation between two esteemed guests. It is my pleasure to introduce our speakers today, the 19th Director of CDC, Dr. Rochelle Walensky, and the President of Emory University, Gregory Fenves. Dr. Walensky is the 19th Director of the CDC and the 9th Administrator of the Agency for Toxic Substances and Disease Registry. She's an influential scholar whose pioneering research has helped advance the national and global response to HIV/AIDS. Dr. Walensky is also a well-respected expert on the value of testing and treatment of deadly viruses. Most recently, she served as Chief of the Division of Infectious Diseases at Mass General and a professor at Harvard Medical School. She has served on the front line of the COVID-19 pandemic and conducted research on vaccine delivery and strategies to reach underserved communities. Dr. Fenves has with a career in higher education that spans over three decades. Dr. Fenves is a distinguished researcher and educator, as well as an experienced executive leader. He came to Emory in the summer of 2020, drawn by the university's mission to create, preserve, teach, and apply knowledge in the service of humanity. Welcome to our guests, and please join me, everyone, in welcoming our esteemed speakers, Dr. Walensky and President Fenves.
Okay. Well, I'll start out. Thank you, Maria, for that very kind and warm introduction. I just want to say our partnership at Emory University with Georgia Bio is very important to our university. And so I want to say hello to all the participants in this event and Georgia Bio. But also our next door neighbor, the CDC. Our relationship with the CDC has been such an important part of this university. And I'm so pleased to be here at Emory, here in Atlanta, with this incredible service, science, and innovation city that Atlanta has become, and really look forward to discussing what Emory's plans are and what we would like to do at Atlanta. As Maria mentioned, I moved to Atlanta and Emory University last summer amidst COVID. And what a time to be at a university like Emory, next door to the CDC in this global pandemic, and to be able to have the expertise of our faculty, our researchers, our scientists, our public health school, and to be working with the CDC and our public health colleagues in Georgia. And also around the country, but especially here in Georgia. So it's been a tremendous time for the past 13 or 14 months now that I've been at Emory and at Atlanta, and I'm very glad to be here. So let me start out and welcome Director Walensky. First of all, thank you for your service to the nation in this incredible time for our country. And if you don't mind, I'll call you Rochelle, since I'm very informal also. And Rochelle, you're new to Atlanta also. So is there anything you'd like to share about your brief time here in Atlanta, and especially leading the CDC?
Thank you so much. I'm so delighted to be joining you today, President Fenves, or Greg, if I may. And I really do hope that we can someday do this in person. It's truly a privilege for me to be here at this premier life sciences conference in the Southeast. And, you know, we too at CDC have our blessed by a long history of partnership. CDC has been a regular participant at this annual conference, and CDC's Office of Technology Transfer has partnered with Georgia Bio for over 18 years. I too am relatively new, 10 months into this job, although had been working on the front lines of COVID, leading our division and doing a lot of work with our state on COVID before actually coming here, really since if we had our first case on March 6th, 2020 in Massachusetts. I think we're all here together to answer really important questions of, if people are hurting, how can we help? What can we do? How can we unite together to make things better? These are incredibly difficult questions, and we often don't have the answers. Certainly, we have more answers now that we did a year and a half ago, but we still also have more questions. As Maria mentioned, my early days of infectious disease were ignited because of my interest in HIV and AIDS, and there have been a lot of similarities related to uncertainty, related to transmission, related to not having the tools that we wanted to do to have to ease the suffering and how we could help people find relief. So we do have this common denominator amongst us all about helping people in healthcare, in life sciences. So I'm really delighted for this conversation. A few quick facts about CDC. I think that not everybody knows within its incredible Georgia and Atlanta hub, and that is we employ about 10,000 people. We're one of the top 15 employers in the state of Georgia, and so much of that, of course, is devoted to Georgia life sciences community and supporting CDC, and especially throughout this pandemic. So these partnerships are invaluable, and I'm really just looking forward to this conversation.
All right, that's wonderful. Well, we're going to have a Q&A back and forth, so I'll start out with the first couple of questions. And at this time in the COVID-19 pandemic, what are the key messages for Georgians and Americans to know about where we are at this point?
Well, I mean, there's one key message I think that we all really need to hear. First of all, we're all tired of this. Nobody wants to be doing this anymore. I want to return to more normal. We all want to return to normal. The truth is that the vaccination is the way out of this pandemic. We need to get more people protected. It's truly incredible that we have several vaccines that are safe, that are effective, that protect us against the variants that are circulating here in the United States. And we came at them in really fast scientific discovery, but because we had invested in so much scientific research in all of the life sciences, many folks at Emory and across the nation in that science, that led us to be able to stand on the shoulders of science to be able to produce these vaccines so quickly. We are all worried about the Delta variant. I've been following the numbers every single day. It may not be the last variant we see, but we do know right now that our vaccines are working extraordinarily well against them. So really the most important message today is to get vaccinated now. And again, I'm not here to convince people. What I'm here to do is provide resources and information so that people have the information that they need and want, so that they want to get vaccinated. And this is for everybody over the age of 12, and more information soon to come, we believe, and we hope for younger age groups. So my message really in this, in terms of what's most important, is not really just to get yourself vaccinated, but to do what you can across your own communities and across your own places of work to promote vaccination and to get people the information that they need. One final thing on vaccination, and that is we're about to enter flu season. And so I can't just talk about COVID vaccination without talking about getting your flu shot. Your flu shot and your COVID shot can be given at the same time if you happen to be scheduled on a schedule for both your first dose of COVID, your second dose of COVID vaccine, or your booster shot. And I do want to reiterate that we had a really mild flu season last year, and that may very well portend to a harder flu season in the year ahead. So get your COVID shot as well as your flu vaccination.
Well, that's I absolutely agree with that. One comment I want to make before asking the next question is the fact that these highly effective and safe vaccines were developed so quickly is truly a scientific achievement. And as you said, Rochelle, it was built on decades of scientific research at institutions across the country, principally funded by the National Institutes of Health. And it has really paid off to save the lives of so many Americans. And so we hope that those vaccinations continue. But one of the things that we have seen with COVID-19 pandemic is it affects different communities in very different ways, and many disparities in social determinants of health, but how then that reacts, is affected by this pandemic, and of course uptake on vaccinations and other interventions. So I know you very strongly believe in the role of CDC and health equity. and something that we at Emory have spent a lot of time working on and thinking about. So what is CDC doing in terms of looking at how to reduce the inequities in the impacts of diseases like COVID-19?
Yeah, this is something, as you noted, Greg, and I know this, you feel the same, that this is critically important to what we, all of what we do moving forward. What has happened to COVID-19 is not different really from almost any infectious disease that we see. And so we in infectious disease had anticipated that this would be the case. I like to remind people that COVID reached our shores through cruises and airplanes. And those aren't necessarily the people that we consider to be using those mechanisms, of people who we consider to be the most vulnerable population. So it really is a history lesson on how quickly you can take a disease that could travel for people who have resources to be on airplanes and cruises and have it quickly spread to those with the fewest resources and those in the communities that have suffered the most. I vividly remember being at a bedside and talking to somebody about quarantine and how their family needed to quarantine. And then vividly acknowledging that the word quarantine in and of itself is a privilege. If you have the capacity to quarantine, if you have the resources to be able to be in a place where you can be have a space big enough to quarantine as a family. And I think we all really need to be reminded of that. The toll of this pandemic, the life expectancy of this pandemic in 2020, at least in part due to COVID, has decreased life expectancy by 1.2 years for the white population, which is truly an extraordinary loss of life expectancy, a huge loss. It has been 2.9 years for the Black population and 3 years for the Hispanic population. And those, I mean, it's more than twice as high than for the white population. And really life expectancy losses we have not seen in our recent history. So, you know, in terms of our ongoing efforts, folks at CDC know that this is really critically important to me. We do have a Chief Health Equity Officer within our COVID-19 response to ensure that our interventions are implemented equitably, that we're actually have the availability of testing and administration of vaccines, as well as we're collecting the data, because we really we came in and not really had a good line of sight as to how our equity data were even collected. I also want to comment that we're making a really huge investment in the community health workers and ensuring that our public health workforce serves and comes from the population where they derive. So we do really want to make sure that each community has its own workforce, its own public health workforce, and we're spending a lot of time and energy in making sure that there are skilled people in all communities. And then, of course, working to make sure that we have equal access to care. I do want to just close by saying that on April 10th, in April, just 10 weeks after my arrival, we declared racism a serious public health threat at the CDC. We're doing a huge amount of work to not just examine the inequities that exist, but actually to implement over the next year interventions that will make a difference in these outcomes. And I'm really delighted that this has been an agency-wide strategic process. We had 150 health equity science applications and interventions goals that were submitted in July. It has re-energized the agency around this common goal to have, I say, bake it into the cake of everything that we do, holistically transform our public health approach. So I'm really excited about that. If I might, Greg, I'm going to turn and take the next question from you. And that is, when you introduced yourself, you said you were relatively new to Atlanta and Georgia, as am I. What do you see as the unique strengths of this city and of this region, particularly as it relates to something so important to you, and that is leadership in healthcare, science, and research and beyond?
Yeah. Well, first of all, we love, my wife and I love being in Atlanta. It's just beautiful, the trees, including just outside my office window, and having 4 seasons, but not getting too cold. So we love being in Atlanta for its beauty. But from a university point of view, one of the real strengths in Atlanta and strengths for Emory is the other universities and the other science agencies like the CDC are here. Of course, our close by neighbor is Georgia Tech, just about 6 miles from here, but we have Georgia State University, a great emerging research university. We have many partnerships with the colleges and the universities in the Atlanta University Center, especially on the medical side with Morehouse School of Medicine. And the University of Georgia is not too far away. So I think having these clusters of universities is absolutely essential ingredient for an innovative region and an innovative economy. Now, I know you're from Boston. That's always been the prime example of clusters of great research universities. I've lived in San Francisco and Austin, which also has those characteristics. And one of the things that was an attraction to me for coming to Atlanta is this cluster of universities and the desire of leaders and so many people across Atlanta to build an innovative economy. And one of the differences that I have seen here in Atlanta is the focus on not just building new companies and an innovative economy, but it's also addressing things like wealth inequality. Who has the access and the ability to start up a company, to meet the needs of a community, and to develop develop wealth and grow wealth. And I believe Atlanta is one of the unique places in the nation that brings these innovative universities, these thought leaders, but also this real drive to open up opportunities to people that have not typically had access to wealth creation. And I know this is a Georgia Bio Conference, but I'm going to put a plug in for the Atlanta Metro Chamber and their ATL action plan for racial equality, which is so much focused on these economic opportunities. So I really do think there is no place like Atlanta for developing these kind of scientific breakthroughs and translating them into not only public health initiatives, better policies to support health, but also into the private sector. So new ways of testing, new ways of delivering healthcare in high quality, more effective, lower cost ways. And so Emory is very excited to be part of that from the science and from the public health and the healthcare delivery aspects. So that's what excites me and gets me motivated every day to continue this work. So I'm going to talk about your transition. So you took the helm of the CDC at a very challenging time, with science colliding with politics in prime time. So with what in your experience can we do to create a better relationship between the public that's often divided on many issues and many beliefs, with understanding what science is and what it can do and how it can improve their lives?
Yes, this has been a unique opportunity to lead an agency during an incredibly challenging time, and also to focus on a time of how CDC can be stronger than ever before. It's been personally unique for me, having come from being a bedside physician that did research in public health. I always walked into a patient's room and they knew I was out in whatever it is I was doing was in their best interest, that I was there to help them. And so it's been a struggle on how to communicate to people who are worried that I'm there representing politics, when in fact I'm there representing public health and what I believe to be the best thing for the American people, and truly because I want them to be at their family's dinner table. And that is really what's motivating me every day. I recognize that I'm not often everybody's trusted messenger, but in fact that other people have other trusted messengers, and if they don't want to hear it from me, that they need to have people within their community, within their professional lives, within their family lives that are their trusted messengers who can help overcome this political divide, which I think is really important. We do know that when that information comes from trusted people, physicians, family, trusted messengers in their own community, that they're more likely to listen, they're more likely to seek out treatment, to get vaccinated. So I recognize in my current role that there's not a one-size-fits-all model. We can't generalize. Everybody has their own reasons for how they behave and the medical interventions that they seek. So we have to treat these one at a time. We have a long way to go, but we do know what works, and that is our grassroots organizations, those people who are closest to the community. So we really are spending a lot of time, energy, and resources in making sure that that we have a community health workforce. CDC has awarded over $300 million over 3 years for COVID-19 prevention and control, and that includes $3 million to the state of Georgia. For those of you who haven't worked with a community health worker before, I think it's really important to have these little anecdotes. And so I'm just gonna tell a quick one, and that is working at Mass General Hospital, we had community health workers in our HIV clinic. And these community health workers were often people who were in recovery, people who had HIV themselves, people who had been down and out once before. And we were particularly worried about a young woman who had been lost to follow-up care. We had known she was off her meds. She had AIDS and she was not doing well, and she did not come to clinic over and over again. And we were very worried about her. So we sent a community health worker to go find her. And he did. He knew exactly where she was. He was able to find her when we couldn't reach her. And she said she was embarrassed to come to clinic because her hair had fallen out from her AIDS. And so she wasn't going to come. And his response was, if I buy you a wig, will you come to clinic? And so there he was. He went and got the resources from our clinic to buy her a wig, showed up with her in her wig to clinic. And that's the power of trusted messengers and community health workers. And I know that that's, I think, what we're trying to do. And not just for COVID, not just for HIV, but for blood pressure control and diabetes control and nutrition and so many other things that we can do in our communities. So I would just maybe remind folks that we're battling the common foe, which is absolutely not each other, but the disease and the virus. So.
Let me follow, if you don't mind, I'll have a follow-up question. So, the scientific method is rooted in objectivity, and it's self-correcting, right? If a scientific fact can't be proven again, then it's not a fact, and so it's self-correcting that truth comes out from science. And so, with your experience as a physician and as a medical leader and now as the director of CDC, how do we make the scientific method and the facts that come out of it, help unite people as opposed to very divisive discussion about whether this is true or not?
Yeah, this is, I think, a really important point, and that is, especially in this moment, science is evolving. We're learning so much every single day, and there are so many research articles that are posted every single day. So our job, I think, together as healthcare leaders is to make complex science easy enough and readily enough for the public to understand. I think we need to admit what we don't know and admit and tell people what we have recently learned. I always sort of get a chuckle when people play back footage from 6 months ago and say, well, you said this. And that is true. That's what we knew at the time. And now things are changed. And I would like the analogy of like, well, 6 months ago, you told me I should use my umbrella. Well, the weather's changed from 6 months from now. So it is our job to convey that when we have new data, when we have new variants, when we understand how vaccine effectiveness is waning, that we work diligently and in real time. And we've worked really hard over the last 10 months at CDC to provide data in real time, publish it in real time. And then, of course, to rely on you, all of our partners, to reinforce the science, to reinforce the information that we are able to provide, and to really try and battle the misinformation that is out there. One of these examples is related to vaccination and pregnancy. And I highlight this example because it's so very important. Our current vaccination rates in pregnancy are about 30%. About 15% of African-American women who are pregnant have been vaccinated. We lost more pregnant women in the month of August than we have ever during this pandemic due to COVID-19. And we know that pregnancy is a severe leads to severe COVID outcomes, not just for mom, but for baby. So we really have a lot of work to do. And I would say, the false claims have really been hurting the pregnant women community. So we have to share information, and we have to do that together. We have to be the trusted partners. And high among those in this moment is to address vaccine hesitancy. Yeah, it's chilling, actually. Greg, maybe I can turn the science question back to you, if I might. What do you think we should do to strengthen public support and the understanding of science?
Well, thanks for the question. I thought you might turn it back to me. So as we've been going through this past year, and this as I said earlier, this collision between science and politics, I was actually thinking back historically to Galileo. So in the 17th century, he proved Copernicus thesis was correct, that the Earth, in fact, did revolve around the sun. But that collided with the theology of the time, the belief system at the time, that the sun revolved around the Earth. And so this collision between science and scientific facts that can be proven with what is a belief system has been around for a long time, and we're seeing the latest manifestation. Now, first of all, that was not life-threatening about who revolved around what. But Galileo also didn't have to deal with social media and 24-hour news cycles and misinformation and disinformation, such as the effect of vaccines on fertility and pregnancy. And so this is a very challenging time. And I want to go back to what you said earlier, Rochelle, that science is always evolving. There's always new information. And so it's really essential that we communicate that all knowledge has some uncertainty to it. And how we communicate that we make the best decisions we can as individuals based on the information we have, but recognizing sometimes that's uncertain and will change in the future. And I think when I think about how we educate young children about science, and from kindergarten up through 12, I think we focus a lot on what's the scientific method, and have students experience mixing chemicals, or seeing how fast a ball drops to understand physical principles. But I think we also need to be starting to introduce in our science education this concept that science is always evolving, that what you read in a textbook is not necessarily a fact. I remember my 9th grade biology course, probably nearly 50 years ago. It's totally outdated because science has evolved so dramatically over those 50 years. So we have to educate young people, so when they become adults and civically engaged, they can understand this information. But we have a problem today, and it is communication, and it is battling disinformation and misinformation, and much of it is one-on-one discussions like you just had it in your story at Mass General. But it's also just being able to be open and to be transparent about what we know and what may change in the future. And I think that's how we need to get through the understanding that science is so essential to our livelihoods and to our health, to our climate, and all the issues that revolve around these big questions in science.
Your anecdote reminded me of my pharmacology textbook, which had no HIV drugs in it. But by the time I graduated medical school, there were a lot of HIV drugs. Right. Following up on your last question, higher ed also, much like science itself and organizations like CDC, has been tested like never before. And so your mission has also been challenged by the public. What are you doing? What can universities do to help strengthen the confidence in science, and then more broadly, the critical importance, especially in this moment, of education itself?
Yeah, well, as Maria introduced me, I've been working in universities my entire career, pushing on 4 decades, and I'm only in this business because I so strongly believe the role of higher education. And whether you look at the economic data about the importance of a college education on lifetime earnings, whether you look at civic engagement data, who votes and who doesn't vote. When you look at health outcomes, it is so highly related to being able to get a college education, and because a college education is so central to understanding yourself, understanding society, being able to answer sometimes complex, divisive questions that we're faced with every day. So I've been a strong believer in that. Now, higher education has been under a lot of criticism for many reasons over many years. Before I get into the real answer to the question, I just have to tell you that one of the criticisms is, why do we need these expensive buildings and these labs and so on? Everybody can learn things online. Well, I was just at we have all our students back in classes, in their labs, working studying in the libraries. And I was at a student event last night, and I was talking to the students, and I wish we could bottle their enthusiasm and excitement to be back in school. And we need to bottle that and make sure every student has it every year to be able to recreate that energy that comes from seeing what we have missed in what college is really about. But one of the things that's been very important to me, and this is back to the questions of equity, access and equity, that I've worked quite a bit over many years, is how do we make sure that a great college education, whether it's Emory or any of the universities in Atlanta that I earlier mentioned, that this is accessible to talented students, no matter what their circumstances are, their race, ethnicity, socioeconomic situation in their families. And we began working on this a number of years ago, and it was really motivated by these important reasons, but also, in my view, some brilliant economists, including at Harvard, Raj Chetty and Dave Denning, and John Friedman at Brown, that looked at this question of the role of college and universities in socioeconomic mobility. This question of a student coming from a low-income family, getting a college education at Emory, at Harvard, at Georgia Tech, and what is their, how many of them get into a higher socioeconomic category some years after graduation. It was really eye-opening to me about the importance, role of college education in that socioeconomic mobility, giving talented students the opportunity for the American dream, to be able to get an education, build a life for themselves, a family, contribute to their community, be engaged in our democracy. And not all schools do it the same way. And that was really revealing in the Chetty data. And one of the things I looked at before coming to Emory is its commitment to socioeconomic mobility. So that's something we are working very hard on here in terms of being able to do that. But if I can have a few more minutes, basically, to get back to the purpose of Georgia Bio, it's universities exist not only to educate and provide those mobility, socioeconomic mobility opportunities, but this is where the research gets done. The research gets done at universities like Emory, like Georgia Tech, like University of Georgia, and so many great research universities around the country. That is the unique aspect of American higher education that does not exist in any other country, and it's one of our secret strengths, our secret sauce of why the United States has been so successful. And of course, in the health area, Emory, I'm so proud of what Emory has done over many years related to HIV, your area of specialty. The inventors of Amtriva, our scientists here at Emory, and Dr. Liada and Dr. Shinazi and their collaborators that helped revolutionize the treatment for HIV/AIDS. Emory was the first hospital in the United States that admitted an Ebola patient when most hospitals didn't want to have anything to do with it, and has been a lead in serious infectious diseases and being at the front lines for emerging diseases for many, many years. And then just finally, the recent announcement, can't say much about it, that's so exciting, in a oral therapeutic for COVID, molnupiravir, also developed by scientists at Emory, that Merck and Ridgeback Bio just announced their application to the FDA for emergency use authorization. It'll be looked at very scrupulously and very carefully by independent experts with the FDA, and but it has the potential for also giving us yet another tool in addition to vaccinations for battling this pandemic. So this is what happens at great research universities here, and where I am right now at our Emory campus, but the great research universities around the country. And that's why higher education in America is so important.
I will say I didn't know about emtricitabine and the Emory connection, having used it for decades until I went on a college tour with my son at Emory.
So let me turn the question back to you. So we're back to where we are and our neighbor, the CDC. We are so proud to have it based here in Georgia, just literally across the street, nearly part of our campus. And so what are your thoughts, Rochelle, about how Emory can work with the CDC to deepen our impact, especially in the state of Georgia?
Yes, I really think that a lot of what we need to do is build what I think you've just described, which is an important workforce for our future in science and in public health. A staggering statistic, at least for me, was over the last decade, we've had an H1N1 scare, we've had Ebola, as you mentioned, we've had Zika virus, and now we've had COVID-19. And during that period of time, we've lost about 60,000 public health workforce jobs in this country. And we have so much work that we need to do to bolster both the scientific community as well as the public health workforce. I'm proud to say that CDC actively participates in the Rollins Earn and Learn. This is a really important signature program that's funded by Emory's Rollins School of Public Health. And it offers full-time MPH, Masters of Public Health, and MSPH students valuable opportunities to earn while they learn through applied public health experiences in real-world settings, and we have plenty of them. So beyond the direct work experience, it's an opportunity for students to be mentored by public health professionals, by people in the CDC and people in state health departments. Really, a robust, well-trained public health workforce is indispensable in this moment. We have seen that we haven't had the strength of a workforce and the infrastructure that we've needed to protect America's health. And the breadth of what that could be the community health worker that I just mentioned. It could be an MD serving as a state or local and public health department director, or it could be a genomic epidemiologist who is needed to understand what variants mean in a lab setting. So we have many opportunities. CDC's Center for Chronic Disease Prevention and Health Promotion funds 26 university-based research centers to identify public health problems and then to develop, test, and evaluate public health interventions that can be applied widely, particularly in underserved communities, as you've highlighted is most important to both of us. The Emory Prevention Research Center strives to prevent cancer and other chronic diseases. So CDC is not just about infectious diseases, but also chronic diseases to reduce health disparities in rural Georgia. And this center conducts research and evaluation studies to intervene on social as well as physical environments that affect both tobacco use, that affect physical activity, nutrition, obesity, and of course, cancer screening. So I'm really excited about the way we collaborate together towards sustainable investments in this public health infrastructure so that we can be prepared for not just COVID-19, but from whatever comes next. And then back to you, Greg, if I might. What is Emory's role as a top higher ed institution and health enterprise in Georgia in contributing scientific, medical, and research advances that directly serve the people of the great state of Georgia?
Well, I want to echo a couple of things that you said, and I'll start out with our Rollins School of Public Health, one of the top-ranked schools of public health. And one of the reasons we have been able to do so much as a school of public health is because of our partnership with the CDC. We have so many Rollins alumna and alumni that are at the CDC. Of course, we have a few former CDC directors that are on our faculty and leaders of the CDC, including Dean Jim Curran, Jeff Copland, and so many others. So it's been a very long-term productive collaboration between the Rollins School of Public Health and the CDC. Addressing workforce needs, our School of Nursing, Mel Hodgson's Woodruff School of Nursing has just been really at the front lines in addressing the nursing shortages here in Georgia, especially in Atlanta and Georgia, and with unique training opportunities for nurses or students who are interested in pursuing nurses, including getting them into clerkships and other rotations in the midst of COVID. So I'm very proud of what our School of Nursing has done. And then, of course, our School of Medicine, which is so closely linked to Emory Healthcare. And just, I want to brag about Emory Healthcare. A meta study has shown worldwide that Emory Healthcare has one of the best survival rates for critically ill patients with COVID-19. So they were heroic frontline workers in our medical intensive care units, developing new techniques and new methods and new treatments for critically ill patients. So it's one of the highest survival rates for those with such serious affliction of COVID. And that work is continuing across the Emory Healthcare Network in Atlanta and throughout so many parts of Georgia in patients that we serve. But beyond that, of course, the basic science and the applied science and the translational science is just in our bones here, and there are just so many examples. I'm gonna just for timeliness just select one, and that's a partnership that we have with Georgia Tech, and of course our joint Department of Biomedical Engineering, which looks at bringing engineering and medical science together for new types of diagnostics, new treatments. New ways of dealing with illness and disease. And through COVID-19, we had a partnership with Georgia Tech and several other universities in Georgia called RADx, funded by the NIH also, which quickly looked at new ways of testing for COVID. And so, we brought the science together with the engineers and with the some other innovators, with first adopters and healthcare systems, including Emory. We were first adopters of one of the technologies that this RADx program was testing and developing. So that's an example, again, of how our universities can work together for very, very important needs, even under critical and if not emergency conditions. So Georgia is our home, Atlanta is our home, Georgia is our base, and we want to be able to serve the people of this state with the best medical care, but also the pipeline of new ideas and new innovations that will address problems that will occur in the future. And so that's what our science and research mission is all about.
I am a unique consumer of the extraordinary people you have collaborated. We have collaborations with, and the extraordinary science and clinical work that you have done. So thank you very much for me personally. Greg, I believe we've run out of time, but I just want to say how wonderful it has been to have this conversation with you, and how grateful I am to you, to Emory, to the Atlanta biosciences community for the warm welcome I've received, and for the ongoing collaboration in science that we will continue to do together.
Well, thank you, Rochelle, for your time. I know you have a very busy schedule, and so thank you for fitting this discussion we've had together. And I want to thank Georgia Bio for inviting us to be able to participate in this important event and this important conference for the state of Georgia.
Well, Well, thank you both. Thank you, President Fenves and Dr. Walensky. This was a wonderful discussion, really fascinating. I'm sure our viewers that watched it live and those that will watch it over the next week and a half will really enjoy hearing all your words of wisdom and advisements. With that, I am going to, again, thank you once again for joining us today for a wonderful discussion to kick off our annual conference. And like you said, I truly hope next year, and my plan is we will be in person for this next year and get back to our 500-600 person events safely, of course, Dr. Walensky. And with that, I will let everyone know we will be doing our official kickoff shortly. It will be a shorter kickoff session than originally planned, but please know that we encourage you to check out our booths. CDC is actually one of our exhibitors, along with many others, and use that opportunity to network with your colleagues while you're on our Julia system. And with that, thank you again, and I wish everyone a happy and healthy rest of your morning, and I'll see those that are with us the rest of the day online in just a little bit. Thank you.
Thank you so much.